Hi folks, this is John Adamson, the Rehab and Documentation Guru. I'm just bringing up an interesting case that I saw today. And this is a patient with Parkinson's. She's in her 70s, so that's close enough where I'm not getting any HIPAA violating information. In her 70s with Parkinson's. And recent diagnosis. Just started on dopamine replacement therapy. Her neurologist sends us an order for maintenance therapy. So this is obviously a doctor that's familiar with it, or it could be that the family member who brought her was familiar with maintenance therapy. So I didn't go in there with a maintenance mindset because all I saw was PT orders. I didn't see the maintenance component. But when I evaluated this lady, it was pretty clear that given the fact that one, she's never had therapy for restoration. Two, she just got started on a new medication for dopamine replacement, Cinemet. Three, she looks like she's got restoration potential, and I've got good information on her from 3 tests. I've got the 30-second chair rise, I've got the tug, and I've got the Tenetti. I think I can make evidence-based progress on at least a couple of those measures. I've got opportunity for restoration. She is not really appropriate for maintenance therapy right now. Now, the question would she be appropriate for maintenance if that's what I went in with the mindset of? And clearly, what I saw was a lady that if she had a non-therapist who would remind her to do exercises every day, she wouldn't need maintenance therapy. I could establish a program today that would probably keep her about where she's at. But I'm not concerned with that. I think I've got opportunity on her. And that's what I'm going to focus on. So the reason I bring this up is that some of you might be in a situation where you get an order from a doctor who's savvy about maintenance therapy, and maybe they were prompted by a family member or a patient who was savvy about it. And you got to look at them is this really a patient that needs maintenance therapy for one thing? Sorry, I don't know why I'm shaky. I need some more coffee or less coffee. I don't know. Anyway, we got to look at them whether they actually do need maintenance therapy, or could we actually restore them? In this case, she had a trifecta of opportunity here. She had new medicine regimen, recent diagnosis, and she's fairly high level, and she's never had restorative therapy tried on her before. So I'm going to give it a shot because I think I've got an opportunity here. Anyway, I hope that just a little discussion might help you if you ever get a maintenance patient. Just some things to consider. I'd love your commentary. Of course, I'd like your likes and your subscription. So anyway, John Adamson, the Rehab and Documentation Guru. Take care and God bless.